morning, it's surgery day. This video is going to talk about what we're going to need and what you to expect on the day of surgery. First off, we need you to be on time. That sets the precedent for how the system flows. So make sure you set an alarm clock, make sure you get up early enough, make sure you get that packed bag that you packed last night, and get to the hospital when the hospital needs you to get to the hospital. Even though your surgery time may be 7:30, the hospital is going to want you there about an hour and a half, 2 hours earlier, because there's a lot to do. What does that mean? Well, when you come to the hospital, you're going to check in. They're going to take you over to the ambulatory surgery section, where you're going to meet your nurse, who's going to go through a checklist of items that need to be done. First, you're going to be asked to put on a gown. Then you're going to get an IV. Then you're going to get a bag of fluids running so that you can get hydrated. Next, they're going to go and ask you questions. Any allergies? Talk to you about what's being done today, who's your doctor. At that point, you might be given some medications to take for pain, as well as some medications of your own that you may be taking because it's time to take some of your medications on the morning of any day. You'll also talk to the anesthesiologist, who will talk to you about what type of anesthesia you're going to have. Are you going to have a general anesthesia where you go to sleep and the breathing tube breathes for you? Or are you going to have a regional anesthesia, which is going to include a spinal and a nerve block that's going to help numb everything so that we can do the surgery? You will see me as well as one of my team members who will introduce ourselves, talk to you, go over the consent. The consent is very important. It's allowing us permission to do that joint replacement, whether it's a hip or knee replacement, and is it right or is it left? We don't want to get that confused. Next, when everything is all said and done, the anesthesiologist may be performing a nerve block on you. You'll meet members of the anesthesia nursing team who's going to help aid the anesthesiologist in doing that block. You will also meet the surgical team, the surgical nurse, the tech, and any other people that are helping that day in the room getting it ready so that you can have your surgery. After that, you'll go into an operating room. I'm warning you, an operating room can be very cold. It is good to have a cold room because it helps decrease the risk of infection, but you won't be cold for long. The anesthesiologist or the team member will help put what we call a bear hugger to help provide warmth for you while we work on your leg. In the end, the room will be cold just for that period of time. Once that is all said and done, you'll get your final anesthesia, whether it's general or regional, and then we're going to start working on the extremity you're having done, whether it's a hip and knee. We'll be positioning you and then prepping and draping, cleaning the skin, decreasing the risk for infection. You'll also be getting some IV antibiotics, maybe some pain medications, and then we're going to do the surgery. Either a hip or knee replacement is going to take anywhere from an hour to an hour and a half. And during that time, if there's any issues, it'll be addressed by the anesthesiologist while we take care of the surgery. After that, you're going to go to recovery room.